Hello, everyone, and I'm Sachin, and you are listening to the ASPIC AMR video podcast series. And this is our second episode on COVID-19 and antibiotics. So, we are going to discuss in this episode the do's and don'ts of COVID-19 medications, especially with respect to antibiotics, whether there is a need for consuming antibiotics in order to get rid of COVID-19, and what are all the consequences of unnecessary use of antibiotics. And this episode is of much importance to us as we are dealing with the issue of antimicrobial resistance, on which our club is working on. And also for this, we have with us Dr. Anusha Rohit, who is a senior consultant and head of the Department of Microbiology from Madras Medicine Mission, Chennai. And we are very happy to have you on this session, ma'am. Thank you.
Thank you for the kind invitation, Sachin and the team members. It is a pleasure to be a part of this series.
So, before starting our discussion, I would like to just have a chat with you regarding your busy schedule. I think this is the beginning of the week, Monday. So, how is your work in the hospital, and how has that changed in these tough times of COVID-19?
Okay, very interesting question. And for many of you who are at the brink of starting your career in microbiology, I think this is very, very important for you to understand how clinical microbiology functions. So many of you may have worked in a non-clinical background, but working in a clinical background, you get a very holistic view of the patient. So a typical day starts with reporting of the cultures that have come on the previous day, that is the 24-hour cultures and the 48-hour cultures. Generally, we look at cultures up to 48 hours, but for samples like tissue or for fungal cultures or for Mycobacterium tuberculosis cultures, or for that matter, pus samples, we have a longer incubation period. So typical microbiology lab can do three basic things. One is looking at core microbiology, which has the basic bacteriology and benchwork. Then you have mycology and mycobacteriology. You will also have a little bit of serology included. Serology is where you look for antigens and antibodies, those kind of tests. And then now molecular biology also is part of the infectious disease spectrum that we are dentally looking at. So on a typical day, once I come, I will be looking at the plates and reading cultures based on which reports are typed, and it is dispatched to the patient. So when the doctor actually comes on rounds, they can look at the reports and understand how, what to treat, whether they need to change the course of therapy, are they requiring to, give a higher antibiotic, or should they kind of de-escalate. So all of these concepts is what they would do on the bedside. Likewise, when they are sending the sample to us, they would have to give us a little more clinical information about the patient. What is the patient present with? Were there any comorbidities? Did that affect? So based on that, there is a holistic report that is given to the patient. And based on this report, the patient's treatment guidelines are generally looked into. So I'm also part of the infection control team of my hospital. I chair the infection control committee actually. So as part of that, I also have additional duties of looking at ways to prevent infection, continuous audit processes, continuous checking at each level to see if the patients are, if the staff are following the protocols that are in place, both for their safety, that is the healthcare workers' safety, as well as patient safety. So considering all this, it's a really full day, and life has changed greatly after the COVID after the COVID came up. So with the pandemic, we had we had to start testing for COVID. So that was a huge pressure because everybody wanted reports faster, so that they could take clinical decisions better, whether the patient goes into a COVID ward or a non-COVID ward. Can you conduct a surgery on this patient? Can you admit the patient in this sort of a room, in this ICU? So all of this does require a report to be given. So that started off like that. And then we went on to looking at different infection control measures, vaccination of healthcare workers. So it's been a whole spectrum. So it's kind of increased the work very much, but it has also given us a lot of experience beyond what we had prior to the pandemic.
Okay. It seems there is a like busy schedule of work. Like the COVID-19 has impacted people's lives a lot. That too, the people in healthcare, working who are working in the field of healthcare, have been more affected with this pandemic. So let's start with a discussion on the COVID-19 medications, especially in connection to the antibiotics. So first of all, I would like to know briefly what is the current treatment regimen for the COVID-19 that is basically prescribed for a patient who is report is COVID-19 positive.
Okay, so the guidelines, since this is an evolving disease, we are currently in a pandemic, the guidelines have been evolving based on the evidence that has come up across time. So, initially, if you remember, at the beginning of the pandemic, everybody, including healthcare workers, were taking hydroxychloroquine as a prophylactic measure and as a treatment measure. But then we found by big studies and randomized controlled trials that this does not have so much of so much of a bearing on the outcomes of the disease. We then went on to looking at favipiravir. So we had obviously this was a pandemic that was with a new virus. We have not dealt so much with the coronavirus group before. The SARS and the MERS outbreak that came up before did not have such large scale number of patients. So, as time went on, we have been evolving our guidelines, and I'll come down to explain what the present guidelines, which is a very comprehensive evidence based guidelines that has been released by the Ministry of Health and Family Welfare and the ICMR. It's a comprehensive guideline for treatment of COVID-19. This was released, this was, I think, the fourth version that was released in the end of May. And according to this guideline, they have classified the disease into four categories. They've classified it into mild, asymptomatic infections, mild infections, moderate infections, and severe infections. Okay. So what they say is for a classical asymptomatic patient who has tested positive but is absolutely no signs and symptoms of the infection, the patient has to remain in home isolation, wear a mask, and avoid contact with others who are susceptible to the infection. And the patient can just remain in home isolation and does not require any sort of medication to be given. For a mild case where there is some symptoms like a little bit of cough, fever, etc., the guideline suggests only the use of an antipyretic, so something to get your fever down, and an antitussive to get your cough down. And they may or may not recommend inhalational budesonide, but that is again on the discretion of the healthcare worker whom the patient is talking to. So a telecommunication is encouraged. With the moderate cases, there is a recommendation for usage of maybe oxygen in case of the patient. So they recommend something called as the 6-minute walk test for the mild and the asymptomatic patients, so that you know if the patient is going to progress towards a more severe disease. A 6-minute walk test is also described in the guideline, which is where you wear a pulse oximeter and you walk on a plain ground inside your house and a plain surface for about 6 minutes. And you should not have a drop in your oxygen concentration below either 94 or a 3 to 5% drop from what is originally there, because that would essentially mean that you could progress towards more severe disease. So what you can possibly do is, first categorize these patients. Then let's come to the moderate category. So in the moderate category, you have a few more symptoms in the patient. The patient is more, there is exhaustion. There is also a lot of, say, oxygen saturation is dropping on and off below 94%. So at this time, you would have to go to a healthcare facility that is looking after after you, and here they do recommend the use of oral steroids, which has probably been the only drug that has caused some benefit to this whole COVID outbreak. So that would be useful. In very severe cases, and those cases which are requiring, so moderate and severe category of patients can also have additionally the use of remdesivir based on a prescription from a senior consultant and not a duty doctor, and it has to be asked even at odd times to the senior consultant before they actually get the results. Now, they have also, in very severe cases, they have said that you could use tocilizumab. This is an interleukin 6 inhibitor that can actually reduce your your ability to fight other infections. So these drugs are with a lot of side effects and should not be used unless they are prescribed based on your your health by your doctor. So it should not be something that's prescribed across the counter. And tocilizumab is a single dose that is given. It inhibits the interleukin 6, which is a very important cytokine that does induce fever, but it is also a very good pro-inflammatory cytokine that is useful in many other infections. So by inhibiting tocilizumab, by using tocilizumab, you're inhibiting your immune system and your normal response towards infection. So this is, essentially, they have also recommended prophylactic anticoagulants, but that is only again in moderate and severe cases and not in the asymptomatic or the mild patients. So considering all this, these are the recommended therapy options that are available for COVID-19. But to come to this, there have been a lot of studies that have actually come up, and they are actually looked at a lot of evidences. So there has been no dearth in the number of cases to look at it. So statistically significant numbers only prove if this kind of therapy works or not. So for plasma therapy has been removed. There has been ivermectin that was recommended that has been removed. The use of vitamin D, vitamin K. There are studies which are actually showing that there is some benefit, but they are not large enough to look at it on a long-term basis, which is why I would think that the present guidelines that has come out is quite well based on evidence.
So, as you were telling, it's important to know that this is an evolving disease and evolving science. As we have spoke in our first episode, like with the emergence of variants and other things, the treatment strategies might also get changed according to that. And moving to the most important part, we have seen many of the prescriptions that are given to COVID-19 patients contain the names of antibiotics like azithromycin and doxycycline. Why are these antibiotics, which are usually given for bacterial infections, are being prescribed for a viral disease? And is it very much necessary for it is must and should that we should consume antibiotics in order to get rid of COVID-19?
So very interesting and very good question. So there were 3 drugs that have actually gone into this category. That is the azithromycin, which is a macrolide, and this actually inhibits the the activity of protein synthesis that happens usually in a bacterial cell. But this drug has also been found to be useful in certain other conditions which are not purely bacterial. Similarly, doxycycline is a broad spectrum agent. So again, it again inhibits the 30S part of the ribosome, which is thus inhibiting protein synthesis, but it is bacteriostatic in nature. And if you look at ivermectin, again, it is an anti-parasitic drug that is used but has shown some activity And so these drugs have been used in the past, but there is no evidence to show that they have any benefit. So right now, the guidelines recommend only the use of drugs which have shown evidence to clear benefit. But these drugs were definitely abused across the globe during the pandemic. And that was purely because of an absolute lack of not knowing what to do during the pandemic. But I'm sure that carrying on forward, as our knowledge base improves, we will be able to treat patients much better with evidence based medicine.
So, with that background, we have seen even many people start consuming these antibiotics which don't have evidence even before they get COVID-19 in order to just avoid future contact. If they come to know that they have been in contact with a person who just turned out to be a COVID positive patient, then they'll just take out the prescription which is given to that patient through WhatsApp and they start consuming so that they don't get COVID positive. So, how bad is that, and what do you advise for such people who start consuming antibiotics, especially antibiotics, as a measure of prophylaxis?
Very nice and interesting question, because I think this is the information that has to go on. So, cancer can develop in any number of people. Do we treat cancer before we even get it? No. So what can you do? You can only have better lifestyles such that you prevent cancer. So with the same with infections like COVID, it is important that you understand that even if you are sitting next to the patient with COVID, there is highly unlikely chance of you getting positive with an infection if you have worn your mask. So a simple measure like wearing mask and doing hand hygiene, it goes a longer way in preventing COVID than popping in antibiotics unnecessarily. So you cannot treat an infection that is not even occurred. So there is no meaning in doing that, which is why it is important to understand that we do not take medications for COVID from a prescription, or for any other infection for that matter, just from a prescription because your symptoms match that of another patient. So that's not how it occurs. It's very important to go by evidence-based medicine. Please contact your healthcare worker who will be able to classify you into a mild, moderate, or a severe case, and based on that, adequate treatment can be given. So this is very, very important, that we do not unnecessarily treat and end up having comorbidities or side effects of that rather than that of your illness. So this is what is important.
So, I think it's very much important to consult a qualified healthcare professional in order to take any of the medicine for that matter. And it's very important when it comes to antibiotics to consult a doctor before consuming the antibiotics. So with that thing, I think we are quite forgetting the ill effects that can happen because of the unnecessary use of antibiotics, which we are doing now, with the fear of COVID-19. That is the antimicrobial resistance, which might lead to a global pandemic, which will be very tougher than the present COVID-19. So, what is your note on that, or what is your take on that? The antimicrobial resistance, and
Okay.
how people should take care of these things in order to avoid the effects that can be caused by the antibiotics usage.
Okay. Again, the pandemic of antimicrobial resistance is called a silent tsunami that is already ongoing. So we are in that pandemic already. So let's not be, hide it under the carpet or push it under the carpet anymore. Let me ask you a very interesting question. Uh, you know, if you've taken, so your gut is filled with organisms which are beneficial, which help to absorb vitamins and other nutrients, which help in digestion and which give you a good health, right? In fact, there is now your gut microbiome is even related to your thinking and your thought process and your ability to develop the gut neural pathways that are there. So it's a very interesting, if you have the older saying that says that, you are what you eat, essentially is coming from that. So let me ask you a very interesting question, Sachin. Please tell me, supposing you take a course of antibiotic, okay, and you know that it not only kills the bad pathogens, it also kills the good bacteria in your stomach, right? So tell me, how long does it take for your gut to get back to the original flora? Okay, so I'll give you 4 5 options. Think about it and tell me what you think is the right answer. So after a course of antibiotic, it takes, do you say, about 1 week, 2 weeks, 2 months, or 2 years?
I think while we consume broad spectrum antibiotics, it might affect very much on the gut microbiome because it kills irrespective of the type of the bacteria. So it might take around 2 weeks for the recovery, maybe.
So there is a paper in Nature on this where they have actually tracked the people after they've taken a course of antibiotic, and they found that it takes about 2 years for your gut to get back to normal. Okay, so this is how much damage it's actually causing you. We don't realize this, but it is a huge impact on the health of the individual. So if you look at AMR, we don't have so much of data from India because a lot of antibiotics are available over the counter in India. But in the UK and US, you have quite a lot of data. So when they did a survey in UK, they found that every 1 in 5 prescriptions of antibiotic is unnecessary. In the US, they found that every 1 in 3 prescriptions is unnecessary. And in India, there's no question of what to ask for. There are, in fact, 34.8 billion doses of antibiotics being given to patients every year. And 65% of that increase has been between the years 2000 and 2015. So it is a recent trend to use antibiotics quite proficiently. So this probably what everybody is looking at from the medical side, especially from microbiologist side, is probably there will be a time when going for a routine surgery may be risky again, or your scratch in the knee that would essentially have been treated very easily earlier will now be a lot more complicated than what it is. So when you talk about AMR, let's first look at numbers to understand how big a problem this is. So every year, 7 lakh people die of infections caused by resistant microbes. 7 lakh people every year. Okay. And of that, you may also have 2 to 3 lakh people, or rather children, dying from antimicrobial resistance. So this is a huge problem. It's just that it's so we flattened the curve so much with this that we don't seem to realize that this is a big issue that we need to actually address. Now, let's look at COVID and antibiotics, like the question that you had asked me earlier. In a recent study, what they found was 90% of the patients with COVID received a course of antibiotic, where only 7% actually had an infection, secondary bacterial infection to even require the antibiotic. So out of the 90% who received the antibiotic, there was only 7% who actually required it. Isn't this a huge mismatch of the antibiotic versus what we are looking at? Now, how can we address this if you start looking at it? Because if we're saying, oh, this is such a big problem now, we need to find ways to address it. It has to be multifactorial. But each one of us can make a difference if we cooperate with our doctors to give them the right information when you're actually feeling sick to require an antibiotic. And when an antibiotic is required for an infection, it is absolutely required. It cannot be not used. But the way to go about it is to have justified use, where you are knowing exactly what you're treating and you are giving the right antibiotic to treat the infection that you're actually wanting to get rid of. So AMR, especially in COVID times, is a huge burden, and I think we will see the effects of it in a couple of years. It's not looking very encouraging.
So, as you were mentioning, it's very alarming to listen the facts and figures with respect to AMR, how rampant it is spreading, like silently, without coming to the forefront. But we should be very careful, like while using antibiotics, like we should consult a doctor, as you said, have a prescription, like follow that prescription properly. And as you were mentioning, there are a lot of multi-factors that are involved in controlling antimicrobial resistance. But what we can do is at least with our like interact properly with the doctor and follow prescriptions which we have taken from them. And also, what is your take on the other side effects that may lead from the unnecessary use of antibiotics, which we can evidently see right now in COVID-19? Like, are you seeing any of the side effects that are being caused due to unnecessary use of antibiotics?
Absolutely. So if you see the whole mucormycosis storm that hit India, one is that India is a tropical country, so spores are all over the place. If you keep a bread piece without using it for a couple of days in your house, you're going to see fungus on that. If you keep a pickle in room temperature rather than in the refrigerator, you may see fungus growing on that as well. Or for that matter, if in the rainy season, even if you keep your leather bags outside, you will have a musty kind of odor, and you will see that there is some sort of fungus growing in. But when you use antibiotics, you create selective pressure. So what happens is the good antibiotic, the good bugs, which are actually protective and do not allow the bad bugs to actually come and get us infected. The good bugs are killed by the antibiotic, essentially keep making us defenseless against the bad bugs that can possibly get us affected. So how do we really address this? There is a concept which is followed by many countries all over the world, and that is called the One Health policy, where you are not just addressing antimicrobial resistance in the hospitals, because that's just one small part. But if you see, if you have an aquarium at home, you will be using tetracycline, tablets into that water. You would be using that. For your pets at home, you would be treating them with antibiotics too. So there is a lot of use of antibiotics in the poultry industry, in aquaculture, in fisheries, in science, in other industries like veterinary, in agriculture. A lot of crops that are grown, to avoid infections in them, antibiotics are used. So when these antibiotics are on the soil, they get washed away into the waterways, and most of the water that we're drinking has very high concentrations of antibiotics as well. So when we're looking at all of these things, it is very important for us to understand that we have to look at it as a whole concept and not just try to address each of these aspects individually. So the best way to do that would be the One Health concept, where we address not only healthcare associated indiscriminate and inappropriate use of antibiotics. We also look at the pharmaceutical industry, the sewage plants, everywhere that antimicrobial resistance can actually occur. Now, why does antimicrobial resistance occur? It is just the way, variants occur with the SARS-CoV-2. It is nothing but the Darwinian law of survival of the fittest. So the organism wants to survive, and as the pressures in the environment increase, automatically the bug develops new and new methods to be able to overcome these pressures in the environment. And that is how you will see that the smartest bugs are those that actually can acquire a lot of resistance without actually acquiring a lot of genes, who can carry multiple resistance mechanisms and are able to survive despite the pressures in the environment. So that is the concept of One Health, and probably this has to come from policymakers. We have over the counter availability of antibiotics in India, so that's a huge problem. Many a times, with from the patient's point of view, there's a lot of pressure to the clinician also, who's seeing the patient, to say, please give me one and one course of antibiotic, I'm going to feel better. Even for viral infections, antibiotics are used. Like the biggest, probably misuse of antibiotics happens with viral respiratory infections, especially upper respiratory infections that are caused by viruses. So that is another huge point. This another important thing is when the patient starts taking the antibiotic, they may suddenly stop taking the antibiotic because they feel better, but they have not completed the full course of antibiotic. If you have been prescribed, say for example, multi-drug resistant tuberculosis in India is a huge problem. And this problem actually came about because more and more people, this is a 6 to 9 months of treatment, and yes, it is difficult to take it for so long, it's uncomfortable to take it for so long. But when you stop the antibiotic early, you will have a breakthrough infection, due to which the patient comes back much more serious, because the first line therapy is no longer useful. So considering all of this, I think we need to have a multi-pronged approach towards antimicrobial resistance. And a very important aspect of that is education, which is where you play a role. So it's important that you spread the right message to people to understand that antibiotics are a useful commodity and should not be abused.
So finally, it is much stressed that we should not go for any of the self medications, especially consisting of antibiotics, because it was very eye-opening remarks like what are all the effects that are ongoing and that might in future occur with respect to the unnecessary usage of antibiotics. So finally, what is your message for all of us in this times of COVID-19 pandemic?
Okay, so first to all of you science students, this is a very exciting time in science because there's so much that you know, and curiosity is very important for anybody in science. So I'm at the outset, I'd like to really appreciate you and your team for taking up this task of increasing the knowledge of people on basic concepts of science and infection. And also special kudos to you for taking a very important subject of antimicrobial resistance to consider on a conversation in your podcast. At that point of time, I also want to tell everybody that there are only two options. That when first, let me talk about COVID, then I'll talk about resistance, because they're two separate topics, and we've touched upon both across this podcast. So when we're talking about COVID, please mask up. Right now, the infections are lower because it is come to a point where there is probably some amount of herd immunity in the population. But we do not need to get complacent. We have learned very costly lessons after the first wave, before the second wave started, because we became complacent about the need for any of the measures to be taken. So the first important thing that needs to be done is please mask up. Unless you are all vaccinated, you cannot take your mask off. It is important to understand that you need to take your vaccine. A vaccine is a very good source of immunity, and it will help us get, at least it will help reduce the transmission of variants that can possibly come through. And please wash your hands, because there's nothing like clean hands. As far as AMR it is very important for you to understand that if you're taking an antibiotic, it is important to take the right antibiotic for the right bug that you are likely to treat. So you need to use the microbiology lab well to be able to understand what to send the right samples, to run the right cultures, and then to get the organism that can possibly help patients. And it is important to listen to your doctor. Don't put a pressure on your doctor to say, please treat me with this antibiotic, please treat me, last time it worked. Please let the doctor decide. And when the doctor has prescribed evidence-based medicine wise, please use that to your ability to follow the advice that is given. Do not skip doses, do not stop your antibiotic in between, and please avoid infections rather than treat them. So that with that, I would like to thank you for the opportunity.
So thank you very much, ma'am. In spite of your busy schedule, you agreed to speak to us, and it was very nice having conversation with you. And also, it's very eye-opening to hear the numbers regarding the antimicrobial resistance, how rampant it is spreading silently. So we should very much take care of the steps you mentioned, like consult doctor and do not pressurize a doctor to just give antibiotics, and also not to consume antibiotics for any of the viral infections like common cold or something like that, and also not to take prescriptions which are being prescribed for any other individuals rather than like the prescription that is specifically meant for you. uh, and it was very much important that we spoke about the antimicrobial resistance in these times of COVID, because people tend to forget the silent pandemic that is happening in AMR and just worry about getting rid of the COVID. So thank you very much, ma'am. And I would urge all of us to follow COVID-19 appropriate behavior and get vaccinated as soon as possible. So thank you very much.